Since 2009 till 2014, there has been strength in the capacity of Uganda Prison Services to offer health services. And from 2015 up until 2020, there has been provision of comprehensive HIV/AIDS, STI, and TB prevention, care and treatment services to prisoners and staff of the Uganda Prison Service in the Republic of Uganda under the President's Emergency Plan for AIDS relief.
Nabule Days is my name. I'm the Regional Health Coordinator of Southeastern. I'm also the in charge of Junior Main Prison Health Center 3. Center for Disease Control and Prevention has done a lot in my region and in prison at large. They are supporting us in HIV testing, where we test our prisoners during new admissions, during on exit and on targeted testing. They are also supporting us in TB screening, where our prisoners are screened on entry, that is the new admissions, and in routine, during the routine extra health service delivery. They have also, and this activity is done in the all prison units. It was first being done in the high volume and the moderate, but now it has been rolled out to the low volume prison units in this region. They are also supporting us in STI screening, whereby all prisoners are screened for signs and symptoms of STIs and managed. They are also supporting us in peers. In the region, we have peer educators who are prisoners, whereby in each wards there are two peers, whereby one acts as a counselor, a peer educator, who gives information, HIV-related information to the fellow prisoners. Then the other one is a cough monitor, who is like a class monitor in their wards. And this one
now, the only thing which I want to inform the people, CDC and prisons has come from very far. If all people could embrace these activities, the prison services, the Uganda Prison Service and the entire country or the whole world at large could benefit so much to a greater extent in the management of the services, or medical services in prisons. Check now, identifying an HIV positive, it is now very easy due to these services. Taking ARVs to the lower units, it's only because of these services of CDC. So if all people could embrace, all departments could embrace, not only prisons, the prevalence of HIV could be fought, or the HIV stigma and other issues in the community could be lowered so much, and the HIV problem burden could be reduced in the community. Very well.
I'm Toya Sarabuki, Regional Health Coordinator, Southern Region. I would like to thank CDC for the great support that they have given to Southern Region. They have provided us with a motorcycle which helps us to carry samples to the regional referral and also to move in the region. Even for the support of the car hire and fuel, we are very grateful because we are able to do our outreaches without any problem. We'd like to thank for the trainings they have given us. We have added skill, the knowledge, and we are able to comfortably provide our health services without any fear. We thank you, we feel you on the ground, we thank you for the funding, we are very grateful.
Uganda Prison Service is a semi-autonomous entity of the Ministry of Internal Affairs, mandated to provide safe, secure, and humane custody of offenders. Having human rights at the center of their correctional programs, has 250 prison units within 16 regions. So far, 55 high-volume, 200 inmates, 103 mid-volume, 50 to 200 inmates, and 100 low-volume, about 50 inmates. Population of approximately 389,975. So far, 9,600 staff and 57,000 475 prisoners, of which 57,600 staff relatives, as well as 265,300 neighboring community members. Over 90% are located far from major towns, limited to social services. UPS, currently with a 5-year cooperative agreement with CDC under PEPFAR for the delivery of comprehensive HIV/AIDS, STI, and TB prevention care.
My name is Sandra Namusana Regina. I'm the Regional Prevention Specialist, Eastern Region, Southeastern Region, Northeastern Region, and Mid-Eastern Region, but I'm based in Jinja, main prison. CDC has done quite a lot. As you've seen, they renovated the waiting area, they renovated the TB ward, they provided funds in the sick bay, there's a motorcycle from CDC, we have staff under CDC here.
However, Uganda Prison Service is experiencing a few challenges. This includes prisoners facing legal and social barriers to HIV treatment access, making them a key population, as well as disproportionately high HIV prevalence among prison staff, making them a priority population, among others. Uganda Prison Services has project primary interventions such as peer education done by the peer educators on HIV, TB, and STI prevention messages, GBV awareness, and psychosocial support, as experts explain.
My name is Atim Susan, Deputy OC Mbarara Women Prison, who is the current acting officer in charge of Mbarara Women Prison. CDC is in full, it is a center for disease control and prevention. CDC has provided package to the clients. CDC has also facilitated the VHTs in the prison. It has as well provided the staff, that is the counselors, because you see with these clients, they need counselors. Then CDC, it has also helped in the renovation of the laboratory. It has also given beds to the TB ward, that is the clients, the prisoners who are TB patients. They have also benefited by getting the beds. Yes, CDC, it has as well given at least hope to the clients, because each time they are in need, CDC is always there to their help.
Senior Superintendent of Prisons, Deogrecia Sogwapit, the officer in charge, Uganda Government Prison, Masaka Main. This is a high security prison with over 1,200 prisoners, and with the inception of CDC in this unit, it has really helped us go a long way with the fighting stigma among the inmates because of one of the projects that we were running within the prison, and that was educating and enlightening prisoners on U=U. I used to have a situation where most of them would shy away from taking drugs, and obviously after knowing that they were positive, they would run away. But with CDC, we're in position to test a list and ensure that 100% of all the inmates are tested and started on drugs.
Okay, I'm Leah George Godwin. I'm Assistant Commissioner of Prisons. I'm the Regional Prisons Commander, Mid-Northern, based in Lira. What I know about CDC is that CDC means Center for Disease Control, and I think we are partnership with the American government. They are the ones sponsoring the project of CDC in Uganda prisons. Of course, now CDC has had some good impact in Uganda prisons. They are handling, they're assisting us in handling HIV/AIDS, stroke, TB in prisons among staff and inmates. There are various programs. Even among inmates, we have the peers who creates awareness amongst the prisoners. Even among the prisoners, we have some prisoners who are in the wards and they identify cases whom they suspect could be for TB. And when they suspect people who are having TB, they report to the medical workers.
Thank you. I am Mayamba Latif, Superintendent of Prisons, Officer in Charge, Soweto Main Prison. I want to talk about CDC briefly, the impact it has brought to prisons. Personally, as the Officer in Charge, Soweto Main Prison, we have registered a lot of positivity because of CDC. Originally, we used to take prisoners to the hospital for HIV, getting drugs, but currently we are doing it in prisons, reducing the risks of escapes because now they don't move out. CDC has also helped us renovate most of the health units around, and I think it's doing a good job.
When it comes to categorization of prison facilities by region, district and population, so far 258 prison units are within 16 regions. Uganda Prison Services has strengthened its human resources. It has established so far high-volume prisons in a total of 55 and 30 art facilities. This includes 103 mid-volume prisons, 100 low-volume prisons, and 25 high-volume prisons. When you take a tour at any of our facilities, ensure to look out for things like renovations funded by CDC, IEC materials on walls, computers funded by CDC, laboratories